What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason, probably not going to change. Had a lot of requests for this topic. I've been doing my homework, trying to figure out the best way to address all of the concerns in regards to the large topic of bullying and lateral violence, because this is a juicy topic that I am passionate about and that many of you are passionate about. But I don't want to spend 30 minutes on a video. So I'm going to take this in pieces. Today is chapter 1 of the topic of bullying. We'll do it in multiple parts. Don't ask me how many parts, don't ask me how many segments. I'm just going to go with the flow, one piece at a time here. Today's topic is bullying. When the physician is aggressive. When the doctor has a hot head and decides to throw a temper tantrum. It can be any type of physician / surgeon. Hell, we could probably even put the advanced practice providers in the mid-levels. Hate that word, mid-level. We could put the mid-levels into this category. Anyone that is not a nurse who decides to throw a temper tantrum at the nursing staff. First of all, it's a touchy subject. This is where you gotta kind of walk on eggshells in the beginning to figure out what you're gonna do. And the reason why is there's politics involved. I don't make the rules, I simply follow them. You don't get to point fingers, scream and yell, and turn this into schoolyard antics of he said, she said. You don't get to place blame on a physician, provider, simply because you feel they were a bully. If they were, by all means, you got some work to do. You got to defend yourself. You got to have enough self-worth to stand up for yourself and say, hey, I don't feel you should be treating me this way. Hey, I don't feel you should be treating any of us this way, especially in front of others, patients, other providers, out in public. Hell, I don't think you should be treating me this way in private. That's the first step, is that you have to directly confront them, but do not do it alone. You want to do it with your manager and or your coworkers. It's not a witch hunt though. You don't go out pointing fingers with your torches saying you need to change your ways. You need to approach it in a very professional manner. You need to approach it, appeal to the greater nature of that person. Maybe they didn't realize they were acting like an asshole. Maybe you need to ask them, hey, do you realize when you did this, it made this person feel this way? A lot of times, that's the reason. They weren't aware of their actions. It becomes very difficult when they know they're an asshole and they still act like an asshole. That's when you have to get management involved, get your ducks in a row, and gather the troops. Because if it's a singular incident between you and them, probably nothing's going to be done other than you addressing your concerns, getting it off your chest, and seeing if it happens again. If it happens again and it becomes a trend, it becomes a habit, then that's when you gather the troops and you start formulating a plan. Because no, it is unacceptable for any physician to treat you in such a manner that you feel bullied or threatened, whether emotionally or physically. Once again, this category is very broad. We are simply talking about the physician that throws a fit in front of you or at you. There's all kinds of other bullying that we can talk about. We're going to take it one segment at a time. Today we're talking about the overt and obvious obnoxious asshole that causes some sort of unprofessionalism in some way. This is not high school. This is not schoolyard antics, so you don't fight fire with fire. You will lose that battle. If you feel that threatened over a period of time by the same person and you feel that nothing is being done, then maybe that environment is not where you want to grow. Maybe you need to go somewhere else. That sometimes is ultimately the answer, is that you need to remove yourself from that ridiculously unhealthy environment. But be proactive in your actions. Be proactive in your thought process. How is that person, how is that physician, how are their actions benefiting your patients? And that's how you approach all of those horrible scenarios. Ultimately, how are those actions affecting the patients? How are those actions affecting patient care? That's how you win that battle. Like I said, there's a good bit of politics that go into attacking this particular scenario, this particular animal. And there is a little bit of crow that we sometimes have to eat in order to get the result that we're looking for. You are ultimately probably going to have to bite your tongue a little bit. Probably going to have to bite your tongue so much it bleeds. You're going to have to be the bigger person. And ultimately, your working environment, while that may suck to a degree, is it affecting patient care in some way? The other part of this is it affecting the team? Not just you, is it affecting the team? If it's just a personal problem between you and that individual, you're going to have to handle that in a very delicate manner with your manager and with their manager and with them directly. You're going to have to grow, hate to say this, you're going to have to grow a set and you're going to have to confront them and tell them how you feel. We live in a day and age now that it is not a yes doctor, no doctor, whatever you want doctor. It is a team environment, and if that physician with their aggressive behavior is affecting the team, the behavior needs to change. Thankfully, over the years, over the past decade, I can say with a great bit of confidence that this particular behavior is not the norm. It is the exception to the norm. 99% of the physicians out there have a very good working rapport with their nursing staff and others, with their team. Even though they are the team leader, they have developed humbleness in utilizing their team to their maximum ability. That it's not a dictatorship anymore. And if you are in that kind of environment and no matter what you do doesn't fix that, it's time to go. Love to hear your thoughts on this one. What are your experiences in regards to this aggressive, idiotic, and stupid behavior, and how did you fix it? Sometimes it takes a couple tries. Sometimes it will take a good bit of effort over a long period of time to fix this kind of behavior. But it can be solved. Want to hear your thoughts? Leave me a comment down below. Your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.